Hello, and thank you for joining the ARC of Fort Bend County Parent Education and Support Group meeting on Zoom today. This support group meets on the second Thursday of each month throughout the school year. The presentation portion, which you're about to hear, is at 11 a.m. And then at noon, those who want to stick around for the support group can bounce ideas off of each other. We just lend support and encouragement for one another. I'm Carrie Axtell, the Advocacy and Youth Programs Director here at the ARC of Fort Bend County. And we're a nonprofit organization established in 1968 for people with intellectual and developmental disabilities. We ensure opportunities for people with IDD and their families to maximize their quality of life within our community. We do that through disability rights advocacy for and with people with IDD, and we provide information about community services, resources, organize resource fairs, support groups for parents and adult siblings. We also hold several high-quality social and recreational programs for people in their teens, 20s, and into mature adulthood. We're also home to the largest Special Olympics delegation for adults in the region that offers 10 different sports with over 100 athletes. If you'd like to learn more about the ARC of Fort Bend County, you can visit our website at arcoffortbend.org and like our Facebook page, which is active and up to date. And you can also reach out to me. I've put my contact information there in the chat. So let's go over what to expect today. When you logged on, your microphone was on mute just to help cut down on background noise and help us hear our presenter better. But if you'd like to ask a question, we encourage you, put it in the chat. We're going to collect those questions. And then at the end, our presenter, Andy, will have an opportunity to answer some of those questions. If this is your first time joining us, welcome. You are in for a treat because there's some exceptional professionals here in the community who share their knowledge and expertise with us. And this month, we're pleased to welcome Andrew Hardwick, the Public Affairs Specialist for Social Security Administration, and he's going to be presenting about Social Security Ssdi benefits and some record-keeping tips. Andy started working for Social Security in the New York City area in the disability program shortly after graduating from BYU. Since coming to Houston, Andy has been involved in public outreach for the Social Security Administration. Andy is fluent in Spanish and has numerous times on the local Univision and Telemundo affiliates, as well as several Spanish language radio stations in the Houston area to carry the message of Social Security to the Hispanic communities and the greater Houston area. Andy has also worked very closely with congressional offices to deliver information about Social Security programs to senior citizens via public forums. He has cooperated with the Office of Inspector General to investigate fraudulent claims. Andy and his wife, Myra, are the parents of 5 children, and Andy is about to retire from Social Security and enjoy some time with his beautiful family. Congratulations on your upcoming retirement, Andy. We're sad to see you go, but also thankful for your years of service and helping the community and learning about the different benefits and programs. So I will turn the presentation over to you.
Thank you very much, Carrie. Thank you for inviting me today, and it's a pleasure to be out here. And I hope after today's presentation, you will have a better understanding of SSI and Ssdi. If you have any more questions, Carrie will share my email with you, which is andy.hardwick, HARDWICK, at ssa.gov, andy.hardwick at ssa.gov. You may or may not know that all Social Security offices nationwide are still closed to walk-in traffic. Only a limited number of people are admitted to the office by appointment, but usually those are for dire need cases. So to conduct your business with Social Security, your number one option is online, socialsecurity.gov or ssa.gov. Either one will work. Otherwise, call your local Social Security office. 1/4 of the staff is at the office, and the other 3/4 are working from home. As to when we're going to go back, I'm hoping that sometime early next year, we will come back to the office and be able to present or give in-person service like we did previously, but we'll have to see. Okay. So I honestly don't know when the offices are going to open up, but you still have the option of dealing with us online or by phone. Now, it is better to call your local Social Security office rather than call the 1-800-772-1213 number. That is still available, but your waiting time could be 2 hours or more. If you call the local office, it'll be much less. All right. So how do you get a hold of the local office? Just go to ssa.gov or socialsecurity.gov and scroll down to where it says contact us. There's a series of blue boxes. One of them says contact us. Click on that. Then scroll down to office locator, put in your zip code, click on that, and you will get the phone number, the fax number, and the address of your local Social Security office. That is the better option. Okay, so let's talk about SSI and SSDI. SSDI stands for Social Security Disability Insurance. Under Social Security, we have 3 programs: retirement, disability, and survivor. Okay, now in order to get Social Security, you have to have worked, or the person under whom you're filing has to have a work history. If neither of those is true, then you're not going to get Social Security. Okay, so the Social Security payments, one of the benefits that we provide is called SSDI, Social Security Disability Insurance. Okay, so that comes from the Social Security trust funds. When you are working and you look at your pay stub and you see FICA, FICA, that stands for Federal Insurance Contribution Act. That's the law authorized by Congress, which permits your employer to take out Social Security taxes from your wages. And that money goes into the Social Security Trust Fund. SSI, which stands for Supplemental Security Income, not Social Security income, Supplemental Security Income. Those payments come from the General Treasury Fund. They do not come from Social Security. They have nothing to do with Social Security. So even though we administer the SSI program, it is completely independent of Social Security. Now, the maximum for SSI for next year is going to be $841. This year, it's $794, but it's going up to $841 for next year. Okay, that's the maximum amount of SSI here in the state of Texas. Some states add on to that, so a person could get more money living in another state, but most states just pay the federal amount, which is $794 this year and $841 starting January. Now, as I told you, in order to get Social Security, you have to have accumulated a certain number of work credits, or the person under whom you're filing has to have accumulated a certain number of work credits. That's not the same as SSI. For SSI, if you're a US citizen, you do not need a work history. Even if you've never worked, you could still qualify for SSI. Now, Social Security is an entitlement program. So there are no questions asked about how much money you have in the bank, how many people live in your house, what other income do you have coming in, things like that, unless it's work income, unless you're getting work income. In certain instances, that could affect your Social Security benefit. But generally, other income does not affect your Social Security. And what you have in the bank or what kind of assets you have, that we don't care. For SSI, though, since it's a needs-based program, okay, it's a public assistance program from the federal government, there are a lot of questions about any other income you might have, how many people you live with, what are you paying toward household expenses, if anything, how much you have in the bank, what kind of assets or resources you have, because all those things affect your eligibility for the SSI program. Both SSI and SSDI pay benefits to disabled people. Okay, so if you have a serious disability and it's approved by Social Security, you could get paid either SSI, SSDI, or possibly both. SSDI pays benefits to the person who's disabled and to their children under 18 years old. So if a worker is getting SSDI and he has children that are under 18 years old, those children could receive benefits even if they're not disabled by virtue of being minors up until 18 or 19 if they're in high school. Now, if they have a serious disability, then at 18, the parent or caregiver contacts us. They fill out a disability report. If that's approved, then that child, that minor child who now reached age 18 will continue on SSI. I'm sorry, will continue on SSDI as a disabled adult child. That's the classification we're going to give them, disabled adult child. Under 18, they don't need a disability decision. By virtue of being a minor, they receive benefits under their parent if their parent is collecting. Actually, if their parent is collecting SSDI or Social Security retirement or has passed away. So in those three cases, if we have a minor child, they can receive benefits under Social Security under their parent. After 18, they have to prove that they have a disability. Now, if a child or a young person is receiving Social Security under their parent, okay, at 18 is the earliest we can classify that child as a disabled adult child. After 2 years, that young adult becomes eligible for Medicare, just like a senior citizen. Medicare, not Medicaid, Medicare, okay? That's the red, white, and blue card, all right? Now with SSI, you don't have to wait 2 years to come on Medicaid. If you are eligible for SSI, you get Medicaid right away, all right? Now, SSI comes on the first of the month, and it gives you eligibility for Medicaid. Social Security comes, well, used to come on the third of the month. Now it usually comes on the second, third, or fourth Wednesday, depending on your birthday. If you were born the 1st to the 10th, it comes on the second Wednesday, 11th to 20th, third Wednesday, 21st to 31st, fourth Wednesday of the month. Okay. So let's talk about SSI for supplemental security income. If you're 65 or older, you don't have to prove a disability to get SSI, but you have to have limited income and limited resources, or what you might call assets. If you're under 65, though, you must prove that you are blind or disabled and you have limited income and resources. And in most cases, you must prove that you are a U.S. citizen and you must be a resident of one of the 50 states, the District of Columbia, or the Northern Mariana Islands. In case you don't know where that is, that's out where Guam and the Philippines and that area, way out. The Northern Mariana Islands belong to the U.S. However, you can still get SSI there. And an interesting side note, if you move to the Virgin Islands or Puerto Rico, which are also part of the United States, okay, you cannot get SSI there. So really, the only place you can get SSI outside the US is the Northern Mariana Islands. Otherwise, you have to reside in one of the 50 states. Now, for a child, for SSI, when we say child, we mean a young person under 18. As soon as the person reaches 18, we consider them an adult. So the disability standards are different. We use the disability standards for an adult. So if you have someone who's applying for SSI and they're at least 18, we're going to use adult standards. If they're under 18, then we're going to use the child standards. Now, under 18, the child has to have a physical or mental impairment or a combination that results in marked or severe limitation in functioning. Okay, so what's going to happen is when you fill out the disability report, which could be done online, DDS, Disability Determination Services. Disability Determination Services is an agency of the state, and every state has one. They contract with the federal government. They make the disability decisions for us. They use a manual called Disability Evaluation under Social Security. Disability Evaluation under Social Security. all you have to remember is Social Security Blue Book. So if you go to Google and put Social Security Blue Book, you're going to see the manual online. We don't have hard copies available. They don't make them in hard copies anymore. But Section A is for adults. Section B is for children under 18. You will see the standards, what DDS is looking for, what Disability Determination Services is looking for in order to determine whether that child is disabled under Social Security standards. Okay. And this condition that the person has to be expected to last at least 12 months or has lasted or result in death. Okay. Now, this is the one that throws a lot of parents for a loop. There are certain conditions under SSI where actually it takes DDS about 3 to 4 months to make a medical decision. That's because they have so many cases, and the treating sources, the child's clinics and school districts and doctors and hospitals, they don't answer right away sometimes. So it takes a while. So usually it takes 3 to 4 months for a decision. However, there are certain conditions under the SSI program. There's 15 different conditions where a person, if they meet the standards for SSI, they could be, if they have one of these conditions, we could pay them while DDS is deciding whether or not the person is disabled. So if we have verification of the medical decision and the person has one of these 15 different conditions, then they could be conditionally approved for SSI while DDS is taking its time and getting the medical evidence and then deciding whether or not the person is disabled. If they decide that the person is not disabled, the person does not have to pay the SSI back, and they don't have to worry about the Medicaid. While they're waiting for DDS to make a decision, they're also covered by Medicaid. If for some reason they should be denied, the Medicaid does not have to be paid back either. I don't have a list in front of me of all those conditions, but some of them are Down syndrome, cerebral palsy, HIV, low birth weight for newborns. Okay, those are some of those terminal cases. Those are some of the 15 cases where there's a high probability that the case will be approved by DDS, so we can pay the person conditionally while they're waiting for a decision from DDS. Now, you may have come up with a situation where you have a parent of a Down syndrome child. Well, that child medically is going to be approved. Okay, that's one of those conditions under SSI where while we're waiting for a formal decision, we could pay the person. However, you may run into somebody, or you may have this experience yourself, where you contacted Social Security and we told you that the child is not eligible. Well, what's up with that? If the child is under 18 years old and there is a parent or step parent in the house, part of the income and resources of the parent and or step parent counts as though they were the child. This is called deeming. Okay, so you may have a situation where the child under 18 is not eligible because it's a two-parent household, both parents work, and there's too much income or resources on the part of the parents. Once the child turns 18, though, even though the child is still living in the same household, still dependent on mom and dad, now we treat the child as an adult, and we don't care what mom and dad have as far as income or resources. So I tell anyone whose child has been denied for non-medical reasons, excess income or resources on the part of the parents or step parents, reapply the month the child turns 18. That's the earliest you should reapply, the month the child turns 18, because then we're not going to count anything from mom and dad. Now, of course, if the child resides in a non-parent household, they're being raised by a relative or somebody else, there's no parents or step parents in the household, we do not count the income and resources of the caregiver or the relative, whoever's raising those kids. Only the parent and step parents, and only up to age 18, not past age 18. Okay, so if you're filing for SSI on behalf of your child, if they're under 18, let me tell you, you cannot do the non-medical portion online. Okay, so the non-medical portion cannot be done online. Okay, so that means you can do a paper application and fax that in, or, which is preferable to mailing it in, or you can call the Social Security office, your local office, and arrange for an appointment so you could do the application by phone. Okay, now the medical part of the claim can always be done online. So if you're watching this, I'm assuming that you have access to a laptop, to a computer, and you are comfortable with doing things online. So you could fill out, here are the forms that are needed, the 8,000. Now the 8,000, okay, is the full SSI application. Really what you just need to fill out is the 8,001, the 8,001. Now, that one, I don't know if that's available, if you can download that, okay? That same, by going to ssa.gov or socialsecurity.gov and scrolling down, remember how I told you you could put contact us? Well, in that same group of blue boxes, there's a box that says forms. Click on that. But I don't think you can get the 8,000 or the 8,001 to download, okay? So what do? Contact me, and I will send you a PDF version of the application for SSI. Okay, this is only if your child is under 18 years old. If they're 18 or older and they have never filed and they're single, then you can do the non-medical part of the application online. But otherwise, the non-medical portion, you'd have to fill out either a paper application and fax that in, or call Social Security for an appointment, a phone appointment, and it'll be completed that way. So the 8,000 is the full application. The 8,001 is the abbreviated application for SSI. The 3820 is the disability report. Now, for the child, this is the disability report for children under 18. For children 18 or over, we have another report. The 827 is the authorization to disclose information to SSA. So we can't go to hospitals, clinics, school districts without having a signed 827, this authorization. Now, if your child is 18 or over, in order for us to release information to you, we need a signed 3288, which is a consent for release of information. Okay, where you get your child to sign, or even if they just can mark an X, and then you put your name there and their name, and that means that we can share any information about their file to you. Okay, now the 1696 is the appointment of representative. That's kind of the same thing. That means that you can look at their file at any time, and you can download information, or you can upload medical information if you want, and you can check the progress of the claim that way. Okay, now if your child is 18 or over, when DDS is through looking at the case, if it's approved, they will make a decision as to whether or not your child is capable or not capable. If they decide he or she is not capable, that means they need a representative payee. That's not the same as a representative. A representative can find out information about the file, their name appears on the record and things like that. But a representative payee means that they are doing business for the person with the disability, because the person with the disability, either physical or mental, is so disabled that they cannot handle their own financial affairs. So the representative payee, whenever the person, whenever our offices open back up again, excuse me, if they are called in, they don't have to come into the office. If you represent your child and you're a representative payee, don't bring your child into the office. You know, there's maybe 100 people in the waiting room, and your child may get anxious and start screaming or who knows what. You don't want that. If you're their representative payee, you come in. We don't need to see or talk to your child, okay? You are going to be doing all the business for them as a representative payee, okay? So if DDS makes that decision, we will notify you and say, you know, you've got to come in. If you haven't already signed the paperwork, you need to come in, and it's form SSA 11. And, you know, we will fill out the paperwork so you can be appointed as the payee. All right. So here's just kind of a look at the first page of the childhood disability report, just asking names and if they understand English and if the child lives with you, and et cetera, et cetera. But it has several pages in it. And it's just asking questions about what doctors the child has seen, what medications they take, and things like that, okay? So the function report, depending on the child's age, this is for the child function report is for children under 18 years old, okay? So after you file the SSI claim, within 30 days, DDS will send you this through the mail, okay? And this you can fax back to DDS. And this will ask based on your child's age, like 1 to 3 is one report, 3 to maybe 6 is another report. So depending on your child's age, they will send you the proper child function report. And it's just going to ask you questions like, can the child read? Do they understand instructions? Can they feed themselves? Can they clothe themselves? Can they use the bathroom? Things like that, okay? So they're going to be comparing this child, again, these are for children under 18, with other children in the community who do not have a disability. You know, maybe a child by this age is expected to be toilet trained and be able to understand simple commands and be able to answer questions. So they will be asking, as far as your child goes, does he or she have any limitations? Can they do this? Can they do that? Okay. All right. And as they say, please include the school progress report if you have it. Okay. Now, if your child is 18 years old or older, the disability rules are basically kind of the same like for a child. It has to be a physical or mental impairment expected to last at least 12 months. Now, for the adults, for people 18 years old or older, they're looking at the age, education, and past work activity and inability to perform substantial gainful activity. So if you have a child who's working and they're earning over $1,350 gross per month, that's an automatic denial, okay? That's what DDS calls substantial gainful activity or substantial work activity. So if they work and they can make at least above $1,350 gross per month, then they will be denied. Now, after they start getting SSI or Social Security, if they earn over that amount, they can still, in many cases, keep their benefit. Now, it might cut them down, or it might, with SSI, it might just reduce them to 0 payments, but it would still keep them on the Medicaid program, okay? And then if their work, for some reason, let's say they were laid off or they were making half as much money, well, then the SSI payments would start again. And depending on what their income was, would, that would affect what amount of SSI they could get, up to a maximum next year of $841 a month. Okay, so here's what the home page looks like. So if you're going to file an SSI application, you go to ssa.gov or socialsecurity.gov, and then you're going to look at this. You're going to see these series of pictures here, and the one that says SSI, you're going to click on that. Okay, and that will take you to the page where you can start the application process for the SSI. This same page, if you scroll down, that's where you'll find those blue boxes that will either say forms, or one of the other boxes will say contact us, things like that. Okay, so for a person 18 years old or older filing for SSI or filing for SSDI, either one, we need a 3288 consent for release of information, a 1696 if someone's representing them. Okay, 827, the authorization to disclose the information to SSA. That's what we send to the doctors, hospitals, schools. Okay, the application for SSI 8000 or 8001. As I said, the 8001 is the shorter form. You can fill that out, and then if the claim is approved, then you would be contacted by us to complete the longer form, the SSA 8000. The 16 is for those that are applying for Social Security that have enough work credits. Sometimes young people that are working in Kroger, McDonald's, or someplace else, they earn a certain number of work credits, and then they become eligible for Social Security disability. So if they have a work history and they have enough work credits, they could apply, besides applying for SSI, they could apply for Social Security disability, and that's form SSA 16, and that can be downloaded. And 3368 is like the 3820, but that's an adult disability report. Okay, again, it's going to ask questions about doctors, hospitals, clinics, things like that. Okay, so this is what the first page of the SSI application looks like. It's fairly easy, just name and birth date, Social Security number, other names the person has used, parents' names, mailing address, and things like that. Okay. All right. This is the disability report, which again is like the childhood disability report, except it's geared more toward, older people. Okay. This is one of the forms that has to be filled out for anyone 18 years old or older. They're going to ask for questions about or ask for information about a person's illness, injuries, or conditions. So not just put, well, this person has this. Okay, but how does this affect or limit their ability to work? Well, okay, maybe they have autism. Okay, so their mental age, their physical age may be 18, but possibly the mental age is 7, something like that. So you could say, well, because they have a mental age of 7, they're unable to understand directions, how to do things, instructions, how to do things. They can feed themselves, use the bathroom, but as far as working, they might be able to do something repetitious, but anything more complicated than that, they would not be able to do. So this is what DDS is looking for. Okay, this is the authorization to disclose information. This is the 827. Now, this form is either if it's a child under 12 or, I'm sorry, if it's a child, no matter what their age. So if they're under 18 or over 18, we need this form. Now, if the child is at least 12, and this is going to sound weird, but we need this form signed by the child. All right. If the child cannot sign, If you can put a pen in their hand and make an X, that's fine. And then you sign there as a witness. Yeah, and that'll be okay. That'll be acceptable. But if the child is 12 years old or older, we need this form signed by the child, even though they may be a minor. Okay, at 12, obviously they're a minor. Whether they have a disability or not, they're a minor. But for some reason, this form, this medical authorization, should be signed by the child if they're 12 or older. Okay, so it just tells you, you know, sign in the individual, and the parent or guardian also signs this form. Okay. All right, this one throws SSI folks for a loop. The living arrangements. Remember, I told you that until the child is age 18, if they're living with mom or dad or step parents, we are considering what the parents or step parents have as though it were the child's. However, once the child turns 18, or if the child is living in a non-parent household, no matter what their age is, we are how much we pay them, how much SSI we pay them, depends on their living arrangements. Okay, so do they live alone, or do they live with other people and share the expenses? Do they have rental liability? Do they pay room and board? Things like that. Okay, so let's talk about sharing. Okay, once the child turns 18, in order to get the highest amount of SSI, which this year is $794, the child has, if he's living or she is living with other people, generally they have to be in a sharing arrangement. Sharing means they are paying their share of the household expenses. What household expenses? Food, utilities, and rent or mortgage. Food, utilities, and rent or mortgage. So let's say a person is the SSI person is 18 or over, and they're in a 4-person household, including themselves. Okay. And let's say the expenses for the month for utilities, food for 4 people, and the rent or mortgage altogether is $2,000 a month. 2,000 divided by 4. We divided by 4 because there's 4 people in a house. That means each person's share is $500. That means in order for that 18-year-old to be considered or over to be considered as living in their own household, which does not mean in many cases living by themselves, but in order to consider that person as living in their own household and eligible for the highest SSI amount of $794, they have to be paying 1/4 of the expenses. 1/4 of the household expenses in this case, well, in this case, $2,000 was the total of the household expenses for the month. 1/4 is $500. So if our SSI person is paying at least $500 toward the household expenses, meaning in a 4-person household, 1/4, then they would be classified as living in their own household, and they would be eligible for the $794 amount. Now, let's say that this person is living in a house, or the family moves. Okay. Now, in the new house, the mortgage, the utilities, and the food is now $4,000 a month. Okay. Well, there's no way that this person can, still 4-person household, 4,000 divided by 4 is 1,000. Well, even if the person gets the maximum SSI, which is $794, they're going to be $306 short of paying their share of the household expenses, which would be $1,000 a month. So what happens in that case is they will then be dropped down to $500 something a month. And you say, well, that's counterintuitive. If they're living in a house where the expenses are higher, they should get the highest amount of SSI. Well, the government does not think like you and I think. Okay, so the rules are kind of hard and fast. But in a case like this, if you came to us and said, this child we now have a room and board agreement with our child, they're going to give $600 a month of that $794 for room and board. Okay, this is what we would charge somebody else also for room and board. So there's still the same thing, except now you're saying that you're taking $600 a month for room and board. So even though the 600 doesn't represent 1/4 of the household expenses, it's less than that, because this is a room and board, a commercial arrangement. Now we can say that the person lives in their own household because they are in a commercial arrangement. Okay. Sometimes people say, what proof do we need? Nothing, just for the parent to come and say, sign a form and say, this is a commercial like arrangement, a business like arrangement. I'm charging my child room and board, and this is what I would charge somebody else. And that's, then we can keep them as living in their own household and still eligible for the $794. Now, there is a difference though when you pay your taxes. And this is something you need to keep in mind. If your child is able to pay their share and they're in a sharing arrangement, you don't have to declare that $500 or $600, whatever they're giving you, as income to you, okay? Because they're part of the family, they're not considered as a separate household. But if you say that you're charging them with room and board per IRS rules, they're considered as living in a separate household. And that means that the $600 they're giving you, which would be $6,000+ per year, you have to, on your income tax form, you have to declare that as income to you. That's like rental income, because now you said you have a boarder in your house. Okay, so those are IRS rules, not ours, but that's just something to keep in mind. Okay. So this is the one where you want to be the appointed representative, and this is where you put, I appoint this person, your name, if you're going to be the representative, and then this would be signed by you. Okay, I accept this appointment. This would be a case where this is for somebody 18 years old or older, where you don't know if they're going to be capable of handling their own affairs. So in the meantime, while the case is pending, you can get information about this case by you signing this form that, yeah, you're going to be their representative. Like I said, if the case is approved and DDS tells us that this person, that your child is not capable of handling their financial affairs, then you will fill out the form to be a representative payee. Then you won't need this form really. Even if we have it, that's okay. But as a representative payee, you'll be entitled to not only know information about the claim, but you'll also be the one answering the questions for the person. Okay. So, and signing the forms for the person. All right. This form, this representative does not give you the power to sign forms for them. This only gives you the power to ask about their case and for us to release this information to you. Okay. Whereas representative payee gives you the power to sign for them. Okay. You will be coming to, or by phone, you will be doing the review with us, because everybody that gets SSI gets a non-medical review every 1, 2, or 3 years. Okay. All right. So again, this is just the representative payee, where you receive and manage the Social Security money for somebody else. Now, you don't put their money in your bank account. You can't do that. You have to have a separate bank account for them. It'll have your name and their name on it. It'll show them as the owners, but you as the representative payee. All right. If the claim is denied by DDS, you have 60 days to appeal. Then the first appeal is a reconsideration. Someone at DDS, other than the person who denied the case, is going to look at it and see if they can come up with another decision. If it is denied the second time, then the case will go to a hearing. If you have 60 days, you can request a hearing to go in front of an administrative law judge. Okay, so let's talk about, what if you have a child on SSI and they want to go to work? Sometimes parents get anxious because they just say, oh, I just got my kid on SSI and now the school is kind of pushing for them to go to work. in the transitional program. Well, the work incentives, and they exist under SSI and SSDI, they are designed to promote independence. Now, the goal is to have the young person become so independent that they wouldn't need government programs, neither Social Security nor SSI. Now, I know that that is not realistic in many cases, okay? Your child may never be able to have a full-time job and have health insurance coverage through their employer, and that's okay, because at the very least, having a job will develop more independence in them, and also give them a chance to have friends, and also have some extra income to supplement their SSDI or SSI. Okay, so please take advantage of this. This is not going to result in an instantaneous cutoff. Right now, under the SSI program, we have certain things that don't count. Earned income exclusion. If your child is working, and we take the first $65, or if they have no other income besides the work income and the SSI, we'll take the first $85, subtract it from the gross monthly income, and then divide what's left by 2, and that's what's counted against the SSI. So let me give you an example. Let's say your child is working and they're making $885 a month, okay? So we subtract 85 from the 885, that leaves 800. We take the 800, we divide by 2, that leaves 400. That's what we're going to count against the SSI. So if your child is earning $885 gross, we're going to count 400 of it and subtract that from the 794. So your child would then be reduced to $394 in SSI. Now, the student earned income exclusion, if your child is under 22 and they could actually earn $7,777 in the year before we count anything. So if your child is in school full-time and they're under 22 years old and they're working, the first $1,950 a month gross, we don't count. So if they earn $1,950 a month gross, we don't count the whole thing until they reach $7,777 for the year. Once they reach that, then we don't count the first $85, divide that, whatever's left by 2, and that's what we count against the SSI. But if they're under 22 and working, until they make $7,777 for the year, if they even reach that point, we won't count any of their income, so they can get their full SSI. Then we have your child could make a certain amount of work, a certain amount of wages, where they get to the point where their SSI is reduced to 0. Okay, but if they still need their Medicaid, all right, then we can still keep them on the SSI program. Now, they won't get any if they've, if they're making $1,800 a month or whatever, they might not be able to get any SSI at that point, but they're still technically on SSI. As long as they keep the rules, we can keep them on Medicaid. And then if tomorrow they're laid off, well, we're going to reflect that in the record, and then we'll start the checks back up again. Okay. So remember, SSI, unlike SSDI, is dependent on other income. So as other income goes up, generally the SSI will go down unless you're under one of these programs. But we have a lot more programs. So we have things like impairment-related work expenses. If your child needs to spend a certain amount of money to get to work, they need special transportation, they can't get to work any other way. Well, if that's approved by Social Security, then whatever they spend on transportation per month, that is subtracted from their wages, their gross wages for the month. That means we're not counting that part. So if they're making $1,500 a month and gross, but they use $500 for special transportation and we approve it, That means of the 1,500, we're going to take away 500. We're not counting 500 of that 1,500. Okay, so that means they'll be entitled to get more SSI. All right. So how do you report work income if they get SSI, okay, or Social Security? Form SSA 821, and this can be downloaded. Okay, this is the one where you report the wages and you put down, do they have any special conditions like special equipment, work different hours than other employees, require special help, things like that. So that's the form that you want to complete if your child starts to work. Okay, please, and especially with the SSI program, but actually with both, please let us know within 10 days if there is a change in income. That's the way it is, especially for the SSI program, because otherwise it could result in an overpayment to your child, which means we will have to cut the checks. All right, so please let us know about that. Okay, now you can also report wages through these, the SSI telephone wage report, the mobile wage report, or the My Wage report. The My Wage report is through your My Social Security portal. I believe that if you as a parent have a My Social Security account, there is a way that you could report your child's wages through your My Social Security account. Okay, now if you're going to report the wages by phone, like landline or mobile phone, you contact your Social Security office by phone, and we will set that up for you so that every month you can either call in, or using your mobile phone, you can put in the figures every month. Okay, now if none of these is an option, you can send us a fax with the pay stubs, or mail a letter with the gross amounts, or phone the local Social Security office. Now with mail, with only 1/4 of the office back in the office, I would say we have a ton of mail, okay, that we get every day, and it's, that's backlog. So the preferable way would be to send a fax. Even phoning, you phone, somebody takes down the information, they might put on a piece of paper, and maybe it gets buried under other cases, and then they don't even realize, and they don't do the input. So if you fax it, I think that's the best way, is to fax the information. All right, and then you have a record of when you send it in. So if there is an overpayment because we were neglectful, we didn't put the information down, then you could say, come back and say, here's the paper, I reported it within 10 days, I faxed it to Social Security. Okay, so, but if you do report that income, you should get a letter within a couple of weeks telling you that, well, we have learned that there's a change of income, et cetera, et cetera. Okay, now the red book and 2021 editions are available. Okay, since we're not meeting in person, you can look at this book online. This gives you all the work incentive programs we have under SSI and Ssdi, or under both, where we're not counting all the income that your child is earning. For instance, something that I didn't mention, under the Ssdi program, you get a 9-month trial work period, where for 9 months, we don't count any income, but that's different than SSI. So you got to be careful when you look at this, that is your child under SSI or Ssdi? If they are under both, there are some work incentives that work for both programs, and there are others that just work for one program and not another. So please be very careful, because what works for one program might not work for others, although there are some work incentives that work for both. So just pay attention to that red book. It's a really, really good guide for you. Okay. I am through, and I am so sorry that I took so much time. I didn't know this was going to take that much time. I know that doesn't leave a lot of time. Carrie, do you want to start with the questions?
Sure, yeah, yeah. And I think one of the early questions was kind of about, I think you may have touched on it, but one of the early questions was discussing or addressing if there's a decreased amount um, received due to in-kind income. Does a rental agreement between parents and adult disabled person work to get around such a reduction? So I think you
Yes,
kind of
yes,
addressed
yes,
that.
it does.
Another one of the questions was about a person who has a child born with a disability, blind, deaf, G-tube fed, wheelchair bound, and was denied, but also went back several times. Says the rep was rude, wanted the government to pay for your child, but she says all that she was really wanting was the Medicaid part of it. So the
Yeah,
insurance.
well, yeah,
There.
we don't see, we can't do that where you just entitle the person to Medicaid. There is a Medicaid waiver through the state, but again, I think it's a disgrace in Texas to have a 10-year waiting period. Okay.
Oh, yes.
So there is I hope as parents and everybody, you advocate, you talk to your state representative about changing that, because that's really a sin. I can't see that. But we don't, under our program, the federal, you have to be eligible for SSI. See, the problem is, I can tell you right now, I'm sure this is a child under 18 years old, so mom and dad's income and assets count, and that's the problem. Now, once the child reaches 18, that may be a long time. I'm sorry for that, but things will change. In the meantime, though, I would say get your name on the waiver list anyway. Just get your name on it. Don't despair, get your name on it, and then advocate to see if they can. Now, Texas has resisted expanding Medicaid, so, but maybe if there's enough feedback from the parents, they will expand Medicaid, and then there wouldn't be such a horrendous waiting time for parents of children with disabilities.
Yes. Now, this particular parent shared that their child does happen to be blind and deaf, so that particular child should qualify under the Medicaid.
Oh, yeah, definitely. Yeah.
Blind multiple disabilities, the MDCP program, which does not have the 10, 12, 15.
Great. Okay.
Yes.
Wonderful.
So, but I think the ultimate answer to the question is, if you have a child, if that child is, under 18, then the parent's income is going to be counted regardless. So there isn't a way for that child with a disability to qualify for just the Medicaid portion of it if the parent's income is too great, right?
Not under the federal SSI program. No.
So the way to get the Medicaid or the health insurance then is through the Medicaid waiver programs.
Right.
Okay. All right. So I think that kind of answers that question. And then another question about needing help with survivor's benefits for herself and her two girls. So do you have a little input on survivor's benefits?
Yes. If the worker passes away and leaves children under 18, the children could receive benefits by virtue of being minors. No disability needs to be approved, and it won't, but once they turn 18, then you would have to contact Social Security if they have a disability for them to continue receiving those benefits. Now, if mom is caring for children under 16, mom can get survivor benefits also, regardless of age, until the youngest child turns 16. But if mom is working, that would offset her, and I'm saying mom, it could be dad, that would offset the parents' Social Security amount. It would not affect the children's Social Security amount, though, but the children could collect money under the deceased parent up until 18 or 19 if in high school, or beyond that if they have a disability.
Okay. Is there any timeline for how soon after the spouse passes to claim that? I mean, does it have to be within a certain time period?
No, but we can only give retroactivity generally of 6 months. So if it's longer than, you may be losing money. Why are you delaying? Now, for that kind of claim, I believe that has to be done by talking with someone. So just call the office and establish a call-in date, a protective filing date, And they will make an appointment for you to come in. Well, not come in, I'm sorry. They'll make an appointment for you to do this by phone.
Okay, she happened to share in the chat that her husband did pass away 9 months ago, but she did file back, I guess, in March. So did capture it within that 6-month time frame. And her oldest daughter does have a disability. So it sounds like she's going in the right direction. She's contacted them right away and is kind of working through the process. But if there's maybe a more specific question, it sounds like the best bet, like you mentioned earlier, is to contact the local office through phone.
Yeah, and they can, if they have a question, they're always welcome to email me. Okay, I can clarify something. I don't do claims. I'm not authorized to do claims anymore, but I can give you information about something if you have a question.
Okay, very good. And I did share Andrew's email address is shared there in the chat real early on. I know I've got some more questions coming in. I'll get to those as well. And I will send a follow-up email to everybody who registered. I will be sending the video link to this recording, as well as the PowerPoint presentation attached. And I'll also include Andy and his email in that email as well. So you'll be able to contact him as well. Here's another question. For an adult with a disability, how many working credits does that person have to have in order to qualify for their own SSDI?
Depends on the age. Okay, so if you're under 31, like if you're under 24, basically you just need 6 work credits. Okay, and the amount of work credits is, let me see, this year for every $1,470 you earn, you get 1 work credit. Next year it's 1510. So for every $1,510 you earn, whether that takes you a month to earn that or 2 months or 3 months, you get 1 work credit. Okay, so if you're under 24 and have at least 6 work credits, you will be eligible for SSDI on your own under your work record. So we have a lot of young people who get SSI, and then later they get a letter from Social Security saying, hey, looks like you now qualify for SSDI. It's probably not going to be a whole lot, but if they continue working, then their SSDI is gradually going to be increased. And if they're eligible for SSDI under their parent or their own work, after 2 years, they will come on Medicare. Now, if you have a child who's maybe 29 when one of their parents passes away or starts getting Social Security, as long as that 29-year-old is single, unable to work because of a disability, if they can prove that that disability started before they were age 22, they could get benefits under their parent for life. Okay, so it doesn't matter, even if the child is, in their 20s or 30s, whatever, if they can show that they have a disability that began before age 22 and one of their parents is either collecting Social Security or passed away and had enough work credits under Social Security prior to passing, that adult disabled child could receive benefits under their parent.
Okay, very good. I know, and there's going to be many, many more questions. Well, I'll cut this off at just one more question, and then we'll again have that contact information for Andy if you have additional questions. But one more here was this particular parent had a child denied for SSI for son when he was 8, had autism because of income, of course. He's now 17 and now he has 2 more younger boys also with autism. Is there, does the income limit change when you have a child with multiple disabilities, or is that a factor?
Yeah. If the child is, yes, it depends on, is it a 1-parent household or 2-parent household? Is the income in the household from work, or is it from non-work, like a pension or child support or whatever? And also, how many other children are there in the household who are not on SSI but are under 18 years old? So the more kids that are under 18 and are not on SSI, that means the less of the parent income we're going to count. So you could have neighbors where the income of the household is the same in both houses, but in one they were denied SSI and the other They weren't. Well, maybe in the other household that minor child had a whole bunch of siblings, so that means that much less of the parent's income we were counting. Whereas in the household where the child was denied, maybe there were no other children under 18, so we counted more of the parent income. So yes, they can affect. And let me just say in closing here, if you go to ssa.gov or socialsecurity.gov and you type in understanding SSI, there's a book. It's about 100 pages long, but it's available online, and it goes into all the rules. There is a chart there. It's called a deeming chart, and it will explain to you how much of the parent's income we count. Like, we don't count the first X amount of money if there's two parents, and if it's all work income, and if there's 3 other children in the household. So it goes through, it explains all that. And if this is the situation, then we don't count this. If this is the situation, then we don't count that. Okay.
Okay, very good. Excellent. And this particular parent said that there's 2 parents, but only 1 income, and that 1 income is the military. So it sounds like perhaps the best bet would be for them to reapply, right? Go see.
Yes. And the 17-year-old, if by chance the income is still too high, they need to, once the 17-year-old turns 18, the month they turn 18, doesn't have to be the day, it could be the month they turn 18, they need to file again for SSI. Okay, then we won't be counting anything of the parent's income or resources.
Right, for that child, that now 18-year-old would apply, have its own.
But for those for those remaining children, if they have autism, in their case, it would be different. We would still be counting the income and resources of the parent, yes, but not for the 18-year-old.
Very good. Well, Andy, as always, thank you so much for this wealth of information crash course.
Thank you for inviting me. I'm sorry. I know it's very hard to put this compactly and give it in, but please take advantage of what we have there, that Understanding SSI, the Red Book. Go to the website. There's also information. Send me an email if you need more information. But I always say, the website is the best site because that comes from our headquarters. That's been vetted. That's the most correct information. Because sometimes you talk to somebody, they've been working for the agency a short period of time, and they might not have all the information. They might give you a curt answer, which doesn't cover your situation and stuff. So I always say, always refer to the website and get that. But if you still have questions, you're welcome to email me. And thank you very much for inviting me. It's been a pleasure. God bless you all, and have a wonderful, wonderful holiday season.
Thank you. You too, Andy. Thank you all.